Hello, and you join me now, warming myself next to the fire. And really what we're in here for is just to show you this is our immersive room. With mental health nursing, we're not necessarily always going to be in a hospital setting. In fact, with quite a lot of nursing, we're not always in a hospital setting. But it's really difficult to recreate that. And what we think is really important, that you're immersed within the role that you're going to do. And actually a lot of that time might be in a patient's home. So you might be in a setting where you need to have a conversation with somebody, talk to them, make plans for their care in the future. And so we have this room in order for you to do that and really feel like you're in that environment, because sitting in a classroom, on a chair, in a lecture theatre is not going to give you that capability. So the same as we would train you to give injections correctly in that clinical setting, we're going to train you to have conversations in a supportive and constructive manner within our immersive room. And this room is fantastic. It can do all sorts of different things. So this is a home setting, and we also have other rooms. So this is another one of our homes. You can hear a dog barking in the background there, which is very realistic, and there's a little Jack Russell, I think, type dog down there. And you know, in real life, sometimes there will be other things happening while you're trying to have that discussion and conversation with somebody. So it's really important that we're able to replicate that, so when you go out into practice, you're able to work within that environment. This is another, I always think this house looks very tidy. But yeah, another home environment that you might be going into to assess a patient within their setting. And of course, different home environments offer different things that we need to look at. Do we need to have a look and see if there's anything at risk? You know, we're glancing around the room and seeing, you know, is there equipment there? Are there issues? Is there anything that might raise a safeguarding concern for me? So this training space can be used for all sorts of different things. As well as these different home settings that you can train in, we also have hospital settings. So we have different community hospital settings, we have outside settings, all sorts of different environments that you can be in. You can even be in the pub, although I'm not entirely sure how many clinical conversations you would be having in the pub, but maybe you want to practice a debrief after your long day at work, and that might be the pub setting that you're using for that. Mental health nursing is, you know, a specialist skill, as is adult nursing or child nursing or any of our other professions. And we want to ensure that you're getting the very best out of your experience at Staffordshire University so that you can be the very best practitioner going forward. You could be working in a variety of different environments, not only people's homes, but hospital settings, call centres, outreach where you go to different hospital trusts or you go and visit people in different areas. But there's all sorts of opportunities that are available to you with a career in mental health nursing, and we're here to prepare you to support the future generations and those out there who need your specialist skills, who need you to be the best mental health practitioner that you can be. So I hope you've enjoyed having a look at our immersive room today, and I hope that I've been able to explain to you how useful this will be as part of your training, particularly as mental health nurses, to really bring you into, immerse you in that environment with your patients, with your clients that you're going to be looking after. And it's really important as part of our simulation-based curriculum that you have these experiences as part of your training before you go out into practice. Now this room was first built as a trial to see whether immersive worked, and it's worked really, really well. So we've got another of these rooms, a little bit larger, at our Stoke campus. And in the new build that we're having here at Blackheath Lane, we're having a much larger simulation room, immersive simulation room that's the size of a hangar, big enough that we can drive our ambulance into it, and we can recreate all sorts of different immersive scenes that you will be involved in through the course of your training, as well as some of the smaller, more focused rooms like this one, where we can concentrate and work on those key communication skills that you need to have to function well as a nurse, and particularly as a mental health nurse going forward. So I hope you've enjoyed the immersive room today, and we hope to see you soon.